Hello and welcome back to another episode of the Pharmacist Diaries podcast. You can't see in this video, but I have a live audience with me today, and this is the first time in the history of Pharmacist Diaries that I am going live in person and with an audience. So this is a really exciting moment for me as a podcaster and as an entrepreneur in pharmacy. This is World Antimicrobial Resistance Awareness Week, and I am doing a series of videos which have already started coming out. 7 days, 7 episodes, a big achievement for me from that point of view as well. But today is a full circle moment because I get to interview my friend, my colleague, and one of my biggest fans for the podcast as well, Claire Brandish. Claire and I worked together back in 2018 when I covered a maternity contract at Buckinghamshire NHS Trust. And that was the first time I also took this podcast from virtual audio to in-person audio. So a full circle moment now. We are back at the hospital recording a series of episodes. Claire is currently the lead Anti-Infectives pharmacist at Buckinghamshire NHS Trust. And she is also the technical antimicrobial resistance lead with the Commonwealth Pharmacists Association. Last time we recorded this episode, it was episode 9. So if you want to go back to that, it's an audio-only episode. You can check it out and hear her full pharmacy story, why she loves the job that she does, how she got into it, and also where she went from band 6 to 7 to becoming a specialist pharmacist. But today we are diving into a different conversation. We are going to talk about the work that Claire is doing on a global scale. We're also going to talk about how she's become a consultant pharmacist and the journey that it took to get there, alongside pretty much full-time working, if not more, and parenting 2 children and working really, really hard on the side to try and figure out how to get this credentialing done. So you are in for a treat, and let's introduce Claire to the podcast. So Claire, how does it feel to be back in the hot seat, but this time on video?
Well, it's a bit different, and I can't believe you persuaded me to do this. But I really want to say thank you to you, actually, because I have followed your career and your journey, and you discussed this. I remember you talking about Pharmacist Diaries a long time ago. This was your passion project. And it's totally been driven by your passion, your enthusiasm, your commitment, your whole family commitment. Sanjay's here today. And you've seen it through, and it has gone to places that I don't think even you saw. And when you asked me to do this week, I thought, I'm not sure I'm ready to come on a camera. But actually the whole week and seeing antimicrobial resistance projects and experiences from different angles, I just think is so important that people understand the pharmacist role, the patient perspective. You had that yesterday, and people at different parts of their career, because it does change. It's very different. My career journey, I've been qualified now 20 years, don't really want to say that. But it's a very different path to perhaps the foundation year pharmacists that we've got in the room today, and their career journey will look very different. And I hope it will be much more exciting and have way more opportunities.
I mean, it's a great memory for us.
It is.
Going back to 2020 when we recorded in the seminar room.
Mm-hmm.
And back then when it was audio only, and it was a big deal for me to come in person. I remember exactly how we did it in the evening after work. And now the podcast and the passion project has grown massively. And I genuinely cannot believe that I am in the position that I'm in, that I've turned something that was an idea into what feels like a full-blown kind of entrepreneurial journey in business, alongside still practicing as a traditional pharmacist. And I'm so glad to be back at Buckinghamshire NHS Trust.
Yeah, we've loved having you back. And I think, again, this hybrid working, so you're still a pharmacist, you're a practicing pharmacist, you know what it means every day to do those duties and those roles and responsibilities. But actually, you've got another area of work. And I think that's what I also enjoy. I'm a practicing antimicrobial pharmacist. I work 4 days a week at Buckinghamshire Healthcare NHS Trust, but I also have my Commonwealth Pharmacists Association role. And actually, that offers so much more in a whole different area and perspective, in addition to my roles at the NHS.
Awesome. I mean, let's take you back to 2020 when we recorded the episode. At that time, you were a fellow. You had started your role with the Commonwealth Pharmacists Association, not in terms of the actual role as technical AMR lead. But at that point, you were getting involved with the fellowship, looking at partnerships with other countries and kind of expanding your global horizon as a pharmacist. So you, at that time, were working with Uganda, with Makerere Hospital, and Nottingham Trent University. Maybe you can just remind our guests who haven't actually seen or watched or listened to the previous episode, what was that journey like for you when you started that fellowship, and tell us a little bit more about that journey.
Yeah, sure. So I actually started as a pharmacist volunteer on the Commonwealth Partnerships for Antimicrobial Stewardship programme. So this is a Department of Health and Social Care's Fleming-funded project. So it's UK aid, and it was initiated to improve antimicrobial stewardship and antimicrobial resistance awareness in 8 of our Commonwealth countries that the UK was to be partnered with. So initially, it was very difficult to find a partner. I didn't know anybody in 8 of the Commonwealth countries that we were targeting. But Kate Russell-Hobbs that works with me, she's an HIV pharmacist and shares a complete love of global health and antimicrobials. We looked at this and we thought, we have to pursue this. We have to see if we're in with a chance. And by luck, really, we found a team on LinkedIn. So that's Makerere University. So you're right, it's Makerere University and Nottingham Trent University. They already had a health partnership, but they were looking for NHS pharmacists. And that was where we could actually contribute. So we had discussions with them. We didn't finish agreeing and deciding until Christmas Eve. So it was a really tight deadline in 2018. 2019, we started volunteering. And that started by myself and another pharmacist going out to scope and really understand the context, because I didn't know anything about Uganda, the health system, what pharmacy looked like. So we did that in the April 2019, and then all 3 pharmacists from BHT were accepted onto the Chief Pharmaceutical Officer's Global Health Fellowship. So that was a leadership opportunity from a personal perspective, but you were asked to deliver on one of the objectives from a Commonwealth Partnership for Antimicrobial Stewardship programme activity. So we worked very closely with our health partners to understand what they would like us to do, and offered suggestions for how we could contribute as well. And then I finished the fellowship shortly after our last episode. We all completed that, and there was a shared learning event, and that was attended by the Chief Pharmaceutical Officer at the time, Keith Ridge, and really supported by a lot of chief pharmacists out there. I certainly felt supported here by Jane Ballinger, and very grateful for those opportunities, because I think you can go on leadership courses, but actually having the ability to demonstrate in practice in a real life situation, sometimes in a very uncomfortable position when you don't know the answer, really helped to kind of consolidate that theory into practice. So finished the fellowship, and then very shortly after, they offered extension funding. So I continued to volunteer on the original project, which was around strengthening antimicrobial resistance awareness in Wikizo district in Uganda. So we were working with healthcare practitioners from a One Health perspective. So not just human health, we had veterinary health there. We had environmental health scientists. So thinking about how antibiotics are perhaps used within the veterinary sector. So sometimes antimicrobials are used as growth promoters, which we know is not ideal, but really trying to dig into understanding why people resort to these methods and what behaviour change we could think about to improve the situation and improve people's knowledge as to why this might actually cause harm, not just for themselves, but actually for future generations. So I continued that work with that project, and I also led on another project, which was with Freddie Katutu as the Ugandan partner lead. So there's an episode on Freddie's career as a health system strengthening pharmacist, and we worked with Makerere University Hospital, which is a hospital that's just outside of the university that serves an interesting population of people. So it's generally students and patients from around those areas in Kampala. And that involved also the dentists as well. So really digging into areas that I I've never had to understand or really utilise in the UK because they always felt quite separated. But this opportunity gave me the chance to look at this from a different angle, to really understand the dentist perspective. It's very easy to say a patient needs surgery, not antibiotics, but actually what does that look like in practice, and can we offer that surgery at the point that it's needed? So I did that, and then after that programme had finished or was coming to an end, that's when I started working for the CPA as a technical advisor.
Oh, so...
And breathe.
Yeah. But no, it's a really exciting journey. I think working internationally has so many benefits.
Mm-hmm.
It really opens your eyes to what's happening around the world, because sometimes when you're in your 9 to 5 and you're doing your full-time job, you're just in the zone. You're seeing what's right in front of you and what you're experiencing on a day-to-day basis. It also makes you a little bit grateful for what we actually do have in the NHS. And I know that we do struggle with resource. We struggle with, having enough funding for staff to cover wards or cover the dispensary. And we don't have enough money for all the drugs that we would like. And even importing drugs from all around the world now is becoming more and more challenging. But in general, we've got it really good.
Mm-hmm.
And sometimes you don't see that until you work internationally. I mean, that experience happened to me working in Abu Dhabi. Though they've got a lot of money, it's still a relatively new country where even importing drugs is quite challenging. And they don't necessarily have as many suppliers as we do. We've got so many suppliers here in the UK and pharmaceutical companies, and they don't have that exposure yet. So even trying to get access to medications when I worked there was really, really challenging. And, my dad's from Kenya, my mom's from Uganda, so I've spent quite a lot of time in East Africa. My grandpa owned a supermarket for many, many years. So it's just that environment, and being in Africa and seeing poverty, seeing what they have in terms of resources is quite normal for me. But it must have been quite eye-opening for you to go out there as a pharmacist and see what access they have to even hand-washing facilities, right? Part of the kind of crowdfunding and raising more awareness and money for them was to actually get them really good hand-washing facilities to allow them to be good antibiotic guardians and think about preventative health as well in terms of hand washing and keeping clean.
Absolutely. I mean, there's absolutely no point in delivering training on how to wash your hands if you don't have hand wash facilities. So the crowdfunding actually enabled the delivery of jerry cans onto the remote islands in Singer and Buzzy near Lake Victoria. And those are still being used today. So it was something that was relatively cheap, but sustainable. And it was suggested by one of the environmental scientists that we work with. And they go out on boats to regularly deliver hand wash training, so infection prevention and control. And they also deliver other training, so antimicrobial resistance awareness training, and thinking about strategies to really protect this precious resource of very limited group of drugs. Thinking about who to actually contact if you have got a suspected infection. And I think your point earlier about Abu Dhabi and importing drugs is really important, because people often think that when you're involved in these projects, it's all one-way traffic. So it's what the UK pharmacists who are specialists in antimicrobial stewardship can offer the teams in Uganda that don't have access to specialist pharmacists. But actually, it's really improved my understanding of drugs as a pharmacist. So substandard and falsified medicines are a really big problem in these areas, particularly with regards to antimicrobials. So the amoxicillin that you think you may be taking might actually not be amoxicillin at all, or it might be a dosage that's a lot lower than what we would recommend, therefore driving resistance. So these are problems, and actually I've had to educate myself to learn more about what do substandard and falsified medicines look like. Would I be able to identify them? And this year we've incorporated that into our training. So the original health partnership with Nottingham Trent University and Makerere University in Uganda have continued this training, but we've incorporated substandard and falsified medicines into that because it's such a big problem. And we do need to educate the public to ideally access community pharmacies that have educated people that can offer the right advice, as opposed to drug stores. But whilst accepting that some people don't have that option, they do not have the luxury of deciding which community pharmacy they go to or which drugstore they access, because they may be limited by time, travel and resource.
I had an amazing conversation with Vanessa Carter, and it opened my eyes to the patient experience. And that is episode 2 in this series. And first of all, she had a 10-year history of working with healthcare professionals, multiple surgeries that she had on her face post-accident. And she said only until 11 months into the journey, where she had already been treated with multiple antibiotics, did someone really explain, or it was like a light bulb moment that, hey, I need to know more about antibiotics. I need to understand what antimicrobial resistance is. I need to know that actually I've been taking multiple different antibiotics and now suddenly they're not necessarily working, and they're constantly having to do surgeries to wash out the area on her face and try and actually treat an infection that just kept on coming back. And she had to try and reach out to plastic surgeons all around the world. She was emailing surgeons trying to find out what she should do next. And she talked a lot about educating the public. And I think that is something that we really do need to focus on, because even having lived in different countries and worked as a pharmacist in different countries, it's so apparent to me that we are not exposing the general public to as much information as they need. In Abu Dhabi, as an example, you can buy pretty much any medication over the counter. You can buy antibiotics from a pharmacy. You can choose when to take them, how much to take them. We had patients that were sharing medications all the time. Things like Saxenda, injections, insulin. So, for diabetes, and they're not even diabetics. And so that all comes down to maybe the government or just, the media trying to raise the profile of really important things like this. And I think the UK is actually doing a good job. I think I'm seeing a lot more content around this information, but I still think that we've got a long way to go. And resistance patterns are changing. We really need to focus on making sure the public have the right information. But I think from our perspective as pharmacists, antimicrobial stewardship within the hospitals it's getting more exciting. People are talking about it a lot more. We are exposing ourselves to doctors on our ward rounds, checking drug charts. We're getting our junior pharmacists to get involved with changing IVs to oral medications when appropriate, stopping antibiotics when they're not needed. If something's been given as a prophylactic dose, reviewing it and making sure it stops at the right time. All of those things are happening, but we just need to kind of like level up and up our game with it. From the perspective of this global work, you've obviously continued doing it for a number of years now. What I wanted to ask in relation to something that you brought up earlier was that how did you, with the fellowship, like how much time do you have to commit to the fellowship? And were you doing it as part of your working hours, or is this something that you do like a passion project outside of work?
Yes, it was mainly done outside of working hours, so evenings. This was the time where we wrote a paper about the benefits of UK pharmacists being involved in these projects back to the NHS, because it is an investment. You do have to be totally committed. You do have to give up your own time. But it was, for me, a very personal growth opportunity. So my confidence grew, my research skills grew. I was filling in gaps within that consultant pharmacist framework that I would not have been able to do had I just had NHS exposure and experience. And that's not to say I don't love the NHS. I still work here because I thoroughly enjoy it and it gives you a certain angle. But in order to become that sort of more holistic, rounded individual, and if you want to create evidence that demonstrates that you can achieve those domains consistently so, then I think you do need to look more widely and consider working with other healthcare professionals and patients. I think patients are a really underutilised resource that we have easy access to. And it's interesting that we go to some great lengths to avoid having those conversations, because actually you can provide information all you like, but what you need is the action at the end of it. you need somebody to demonstrate to you back that they've understood that actually taking antibiotics, if you don't need them, can cause you harm. So I'm going to choose not to do it, or I'm going to choose not to share my supply with somebody else. So it's actually seeing it through right to the end and really understanding if you've had the effect that you want to on the outcomes.
Yeah, no, I love that. And when it comes to the actual application process for these types of partnerships, obviously you've got to find partners. That can be quite tricky.
Yeah.
But you found someone through LinkedIn, which is awesome. Tell us a little bit more in detail about what the application process involves, because I'd really like to see more pharmacists getting involved with these types of projects. I think that they are so fun, such a great opportunity to meet new people, connect with people around the world doing really similar things to you, but also you get to support them, they get to support you. Those pharmacists came to the UK. What an amazing opportunity for them. But you also learn more about the specialist area that you work in by collaborating on a global scale. And I'd love to see that more people get involved with this. So what's the application process like exactly? How long does it take? What kind of information does it involve?
So the application process, the last time, it involved having an identified lead within country and also a UK lead. So I have done this, and you'll speak to Bea later on, and she's also been involved in that. It's actually quite challenging putting grant money through an NHS trust, just because we don't always have access to the right people who can contribute voluntary effort as well. So I am not a budget expert, I'm not a finance expert, but what I can deliver is the AMS and the sort of the fine detail of the project. But what I would love is for people to collaborate with that are outside of pharmacy, outside of the medical professional, to help us kind of get these projects off the ground so that we can monitor them, and we can make sure that the budget and the finances are all shipshape too. It's quite daunting, I think, going into a grant application if you've never done it before. So certainly for me, linking with the universities where this is their bread and butter, because I've done CW PAMS and it exposed me to the research area, I now approach my research and innovation colleagues at BHT, and we've worked on a number of projects, or are working on a number of projects subsequently. But I wouldn't have thought to do that early, and I wouldn't have thought to make those connections. So utilise the resources that are around you. Every hospital trust will have a research department. See if they can help you. See if your finance team can help you. Be brave, ask around. You'll be interested to find out who's actually been involved in global health projects within your trust, because we certainly found that there had been experience before, although it hadn't really been acknowledged by the trust. So going forward, we didn't want to make the same mistakes, but actually learning from previous experiences sometimes just as important.
Curiosity is really important. I mean, I had a conversation with our 2 plastic surgeons here yesterday through Teams, talking about guidelines, of course. But I also asked them about their trips to India, what they're doing.
They do loads of work.
And why they're getting involved, how do they get involved? Have they ever had a pharmacist? To see what kind of support that we might be able to give and whether or not we can support them with anything exciting. And part of that is just my curiosity to learn about other people. And I think that's really important to share. If someone's watching this video and they are a junior pharmacist or maybe a pharmacy student, it's literally just, can I have a conversation with you to learn about what you do and understand how you do it or why you do it or what benefits there are? We've got trainee pharmacists in this room who are listening in thinking, actually, yeah, you're right. I do need to have the confidence to actually speak up and just ask my colleagues, what interests them about their job? What are they passionate about? Because that curiosity can lead to a conversation that might end up being, oh yeah, get involved with some audits that I'm doing, or I'm working on a research project. Sure, if you'd like to volunteer a couple of hours per week, come and join me on the project. I'd love the help. I've worked with doctors back in the Evelina doing research in pediatric infectious diseases. And at that point, quite a few years ago, I hadn't really been published. I hadn't really got involved with research. I knew that it was something that I wanted to get involved with, but I was scared to do it alone. And I didn't really know where to start, especially because when I moved to Abu Dhabi and worked in a very operational and leadership job, I didn't really get involved with research at that time. And I also was the only pharmacist in the organization. So there was no other pharmacist to kind of bounce ideas with. And that was really tough for me, but I had to just step up and learn how to be a leader in that job. And coming back home and then transferring back to a clinical role, being patient facing, that was really tough for me. So I knew what my barriers were, what my obstacles were. I knew my weaknesses. And I thought, actually, let me just ask the registrar, can I get involved? And he's an incredible PhD advocate. He's done loads of research, and he just helped me to figure it out. Yeah. And we published it together, and he put my name first because he was like, yeah, do it. Like, make it happen. This is exciting for you. So a lot of the journey when you are identifying things that you don't know anything about, or you've got those weaknesses, or you need to fill in gaps, as an example for your credentialing, or maybe you're doing the foundation or the advanced pharmacist framework for RPS. These are things that your curiosity will allow you to achieve like amazing goals. And part of that is just ask a question.
Yeah, absolutely. And I think if you're not ready to take on that grant application, then actually there are a number of established health partnerships out there. They're all available on the CPA website or the Global Health Partnerships websites. So just contact them and say, I'd like to volunteer in a global health project. Is there anything out there? I know King's Global Health Partnerships and Cambridge Global Health Partnerships often advertise for voluntary roles because they've got charities to do that. But actually, if somebody contacted us, for example, how could we get involved? Then we'd have a conversation to see if there's any scope for a role or whether there's another team that actually they might align better with. Because I've had conversations with Band 6s who, I work in Uganda, but they've got links in Nigeria. So they would rather, work in Nigeria because it's more familiar and they feel like that they could understand that better. So actually contact one of those teams out in Nigeria, see if they need a pharmacist that can do some voluntary work and get involved that way in an established team. And then at some point you might feel like you've got these skills and ability and experience to actually take it to the next level and do the grant application yourself.
Yeah, definitely. And even when you do the grant application, it's a tough process. There's a lot of information to fill out. You've got to think about the finances, the objectives of the project, how you're actually going to support each other with regards to the partnership. And there's no guarantee that it's actually gonna work out because it can be quite competitive. But I think when you look at these things, you have to look at it as a learning opportunity.
Absolutely.
So if you don't make it the first time, then get feedback from them as to why and find out how to improve your application, because then the second time around, you're more likely to be awarded the fellowship or the project or the partnership because you have worked on the application process a little bit more in detail. And that's all part of the learning journey, right? When it comes to CPD as a pharmacist, you're just continually developing. And that means that you might come across barriers that, don't allow you to do exactly what you want when you want it. But you've got to just try.
Absolutely. And I think, certainly our in-country partners, the improvements that we've seen, particularly over the last year, because we fed back that there wasn't an African opportunity for a fellowship when we did the Chief Pharmaceutical Officers one, because that was for the UK. So they have implemented that in the last phase for CW PAMS. And actually, there's some really strong leaders out there. So our colleagues who are working in the 8 Commonwealth countries, and they have gone on to much more senior roles, working with ministries of health, working at the WHO. And that's really exciting. This is succession planning. This is what we should be looking to do, both in the UK and in other countries. How can we skill up our workforce, really push each other, celebrate the wins that we have, and actually move that knowledge and that passion into areas where we've got capacity to actually influence decision makers and policy makers, so that actually, yes, AMS is part of the pharmacy curricula. And actually, yes, they will support, laws and the implementation of that so that we have safer access to medicines.
Another thing I wanted to say is that within your team, multiple members of Stoke Mandeville Hospital staff have had the opportunity to get involved.
Yeah.
Arash, Natasha, Kate, B, yourself. That's, 5 people.
I'm a collector of pharmacists.
Yeah. But you're inspiring people. You're helping, you're moving the needle forward. You're inspiring and motivating people. And I know you definitely are going to tell me that wasn't your mission. That wasn't what you kind of intended, or you don't see yourself in that way. But you've inspired me from really early on. When we first met back in 2018, I was super inspired by your story, by your journey as a pharmacist. And it's, this full circle moment is so nice for me to come back and work with you. I was so excited that you called and was like, oh, we've got locum money, come and work with us. And
I'm not sure who authorised this, by the way.
We keep saying that, who authorised the fun. But I just think it's really exciting that, it's a snowball effect. You do something that you love and that you're passionate about, and other people are kind of hopping on the bandwagon to do it with you. And that's kind of what pharmacy and community is all about, is that you work together, to have fun, to enjoy the work that you do, expose yourself to different environments, but also it's about training and teaching other people. We've got B, who's coming on to one of the episodes this week, and she started off as a junior pharmacist, fell into your team, and boom, she's antimicrobial stewardship all the way.
B is incredible. She's an incredible individual. And I think it comes down to it's hard work, commitment, and passion. And again, I mentor some of the Alpha Fellows, and the person I mentor is an incredible, amazing pharmacist. But what she actually needed was a cheerleader. She needed somebody to tell her that, because actually you don't always get that at work or within your working environment, especially when the MDT perhaps doesn't quite support you. Some countries aren't so pro MDT. And we know, having worked with a diverse range of other healthcare professionals, that we bring our best expertise to those meetings. So the patient has the best outcome. Talked about the plastic surgeons earlier. I think it's wonderful and amazing how far we've come with them, because they have incredibly complex patients. So actually really understanding, what can you do for this patient, and what do you need us to provide you information about in terms of managing infection? Because it is so complex, and there are a number of working parts within that puzzle, I think, to try and achieve the best for the patient.
Yeah, I love that. I want to move the conversation on to becoming a consultant pharmacist. An amazing achievement. Big clap. Well, small clap because we've got audio. But I'm so proud of you for getting that done. It's not an easy journey.
No.
And I'd love to hear kind of the story behind that. At what point in your journey did you decide, I should do this? I need to do this. I know that I can achieve it. And it did take quite a long time. And I think for a lot of people, it does take quite a long time. And when I mean a long time, a lot of people say it takes up to 2 years to get the credentialing completed. And that's a journey alongside working, alongside parenting, your own life. You're doing the global work that you're doing. So you've got a lot going on. Share that story with us and the good and the bad.
Yeah, so I think this goes back to having all the people around you that will support you, but you just have to reach out. So I actually contacted Nina Barnett for advice, because I wanted to do the consultant pharmacist credentialing, but it was about to change when I sort of revisited this idea. So they're about to launch the new curricula, and she advised me to wait for that. So I think that was early 2021. And it's all about finding these expert mentors who can give you valuable feedback. So, take the celebrations, but also take the advice about how you can improve yourself. And it can be really difficult finding an expert mentor in each of the domains. But there are people out there who will gladly and willingly help you, but you do need to ask and you do need to find them. So sometimes it's not the obvious people you think that will help you. It's maybe somebody you've never met before. So I am eternally grateful to all the expert mentors that I had, because they could have said no. They were giving up their own free time to read my interventions and give me that feedback, tell me honestly where my gaps were so that I could go out and find the opportunities to fill them. So experiences that I'd never had within pharmacy before, I would then go out and ask to do. It took me 3 years to complete the pharmacist credentialing journey. I lost my dad late 2021. He had a massive stroke, which was completely out of the blue. And that really shocked me, actually, because I lost all my love for pharmacy. I just felt like I was working on an autopilot. I knew I could come to work. I knew I could be a good pharmacist and keep the patients safe. I could do what I needed to do, but my love for the job had just gone. And that terrified me more than anything, because that was always the thing that I had. I had a job that I enjoyed. So for a while there, I let that go. And then I got in touch with the trust were running a coaching scheme where you could ask for a coach. And I had this wonderful woman called Claire Daniel, who's our chief psychologist, and she offered to coach me. And actually, I just needed somebody to bounce those ideas off. I felt for a long time that I'd banged my head against a brick wall, because I have worked in antimicrobials for a long time and I really enjoy it. And I still find the challenges with it. But there was a moment, and I think it was probably due to grief, but, I just thought, should I just stop this? I could just apply for a more senior position, doing another role. Why do I always look for the hard path? Why do I make work for myself? So I took a job covering a secondment as an associate director of pharmacy. And, that game gave me so many experiences that I wouldn't have had the opportunity to do otherwise. But I didn't love it in the same way that I love being an antimicrobial pharmacist. So actually that experience gave me the reason to go back to the credentialing program and think, I've got to get this sorted. So I just worked hard, and I contacted people and put myself into very uncomfortable positions, asking for feedback, because you get it when you're a foundation year pharmacist and when you're doing a diploma. And actually those are the lucky days, believe it or not, because people will tell you how you can be better, and you get to a certain level and people stop giving you honest feedback about how you can improve, and we can always improve. So I submitted my portfolio at the start of the year and was incredibly fortunate to pass that. I'm not sitting in a consultant post. Sam, if you could sort me out one, that would be lovely. But I did it for me as well. I did it to prove to myself that I wasn't missing anything, that people could corroborate, what I was putting down. I've always suffered with lack of confidence, but I needed that evidence to myself, if you like, that I was working at a certain level. And that could be supported by evidence. I'm a real pharmacist there, aren't I?
Da, 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 da. But it's quite hard, because there isn't always funding available when you do that credentialing. Mm-hmm. And that's something that I've talked about with other consultant pharmacists who I did a series with earlier this year. And a lot of people get deterred because they feel like it's so much work, it's so much time, it's so much effort, it's so much energy. Mm-hmm. And then your employer doesn't necessarily reward you for it by giving you the post that you deserve, or there's not funding to kind of move you up the kind of NHS banding scheme. And that can be quite hard for people, because I guess they want to be rewarded. And I'm not just talking about financially. It's about the position,
the recognition,
and the recognition
of the role and
right?
responsibilities.
Yeah,
yes.
exactly. Yeah. And that can be quite hard. You do all of this work, but actually you stay in the same job and you don't necessarily utilize it. But I think it's so amazing to record all the things that you're doing, because on a day-to-day basis, there's loads of incredible things that senior pharmacists and specialist pharmacists are doing. And if you're not necessarily recording the evidence, and I found that with podcasting, and completely different topic, but until I recently am now coaching people on how to start their own podcast, and I wanted to show them the step-by-step framework as to how I got to where I am today, I literally had to go back in time and think about, okay, when did I do remote audio? When did I then do it in person? Then when did I switch to remote video? Like all of those are key milestones for me. And when I created it in a little image, I was like, whoa, I've done so much. And it's only until you write it down or demonstrate the skills and the experience that you've got that you really truly understand like how incredible the whole journey has been. And also, it's so important to look at where your gaps are. And I do a lot of reflection. I do a lot of journaling. I write things down, whether it's my feelings, what I'm going through. When I'm applying for different jobs, I'm looking at things that I've done in my previous jobs to prove some of the skills on the job description or the person specification. And it's only in those moments, usually, that I start realizing how far I've come. Or I realize, oops, I haven't done the research element, or I need to do more education and training. And this then highlights that, okay, I need to work on projects that will allow me to build on those skills. So part of that credentialing process is great because it identifies those gaps. It strengthens you where you need to be. But the one of the beautiful things about that is that you start discovering more about yourself because you get exposure to different things that you didn't necessarily think about before. And then you might fall in love with them. So it's just something that, you know, molds your personality, helps you with your career journey, but you're just moving one step ahead each time that you're kind of documenting the journey.
Absolutely. I think it is that point of reflection. You're always looking at your to-do list and you never look back and think, wow, I've actually, you know, and it's that daily practice, isn't it? We're daily practicing pharmacists. So of course we should be moving in the right direction. But I've also said yes to things that I wouldn't necessarily have done previously. So working with the monitoring, evaluation, research and learning team at CPA, I mean, it's just blown my mind at times because I'm working with genuine research pharmacists from Portugal, Canada, Turkey, and I join them on a 7 a.m. call on every Wednesday, and they have taught me so much about the different research styles, different practices, and it's the utilization of that in a real life setting, I think, that makes a difference. You're not just learning the theory, you're actually using it. So certainly those pharmacists have just added so much more to my understanding of being a pharmacist and what you can do.
Awesome. I guess one last question is when we look forward and we look into the future, and we're looking at this from the point of view of antimicrobial stewardship, antibiotic resistance, what would you like to see in your team or within the hospital that will help to make improvements to patient care? Like what's our next step? And actually, I'm with you on the journey. So it's kind of like
You're
team
on the
building.
bus,
I'm on the bus. I'm coming with you. What can we do to make things better for us?
So again, I think just bringing that experience of global health back to the UK, earlier this year, we started a Buckinghamshire, Oxfordshire, Berkshire West, so Bob, Integrated Care System, One Health Approach AMS committee, and actually invited some vets, invited some dentists. We've got human health sitting around the table from a range of different settings, so care homes, prisons, hospitals, the community, looking at the Pharmacy First scheme. So how can we collaborate better together to understand this problem and actually put into place some of these measures that we think can work and then see if they are actually working? I think we need to do more collaborative working from a One Health perspective.
And I love that approach because we do a lot of multidisciplinary team working within the hospital, but those are all mainly, you know, doctors, nurses, different healthcare professionals within secondary care. But I really like I've attended the Bob meeting and it's so nice to see other healthcare professionals on there. Even like the communications team are on there.
Absolutely.
It's such an
They're
important
key.
and vital role, right?
Communication's key. And we also had some health advocates on there as well. So these were roles that started during COVID for the vaccine hesitancy. But how can you deliver some of these messages through parent WhatsApp groups or, you know, during some fitness or exercise activities? So it's drip feeding the information through areas where people congregate, churches, you know, different groups, so that it becomes part and parcel of everyday conversations rather than this really clunky antimicrobial resistance talk that we have. So it's about healthier communities.
I love that. And maybe I'll recommend that we do a lot more video and get digital.
See what happens.
Yeah, watch this space. Thank you so much for...
I'm so grateful to you, Anisha. Thank you so much for all your efforts this week, because I know this has taken up so much of everyone's time and time away from your family. So I'm really grateful. Thanks.
No, it's absolutely fine. I'm so glad that we got this opportunity again. Honestly, it's a full circle moment for me. I'm really grateful, to be working with you. I've got my locum shifts going on, which gives me the flexibility. This is exactly what I needed, right? At the time where life was incredibly challenging for me, sleep deprivation, young children, and I was kind of trapped and didn't really know what my next move was.
But
you
have
just
that
came
conversation
to my rescue
with a colleague, because somebody else has got that perspective and they know what you need. So you need to listen to your colleagues and take the advice.
Agreed. But yeah, thank you very much for spending an hour with me, having an amazing conversation. And we'll do episode 3, maybe in 2 or 3 years for the next update. Can't wait.
Just got that in there, didn't you?